a joint initiative between Brigham and Women's Hospital, Harvard Medical School, and Harvard THM School of Public Health. Well, simply put, giving care to the neglected surgical patient, towards giving care to patients who need care for trauma, surgery, obstetrics, and anesthesia. And as we developed these metrics, which of course we didn't go build new metrics. We relied on our member organizations. So we had great data that was already developed by the DCP3. Fantastic work from the Lancet Commission. Other WHO core indicators, and this committee sat together, deliberated, did webinars, got lots of input from all the stakeholders, and came up with a list of indicators. Now that's great that we came up with that list of indicators, but then after we presented them, we had an amazing breakthrough. Come up together. So what he's showing is that how we can go from the power of 1 to the power of 60 in just 1 year. And that's what the G4 Alliance is all about. And it's amazing to see that happen. The best predictor of the future is past performance. And look at what already coming up with a fantastic indicator list, which is now being proposed at the highest levels. And these are just 2 accomplishments. And I know if you go through and ask several of the board members, they will give you
testing
the list several more. But the biggest accomplishment is that we're here a year later and we're growing, and that the alliance is
1, 2, 3.
Bringing about a harmony.
Testing 1, 2, 3.
And we need to be able to make a difference, to eradicate the neglect of
testing.
And I think because we see such great performance in the first year, our future is bright, and hopefully it will come when we're not needed.
Okay. All right. Testing 1, 2, 3. Testing 1, 2, 3. Yeah, I know.
Good evening, everyone. Thank you for joining. If I can ask you to find a seat, and if you don't have a seat, we're glad you came. Tonight, we are gathering for an event that focuses on the importance of surgical care as part of universal health coverage. And we're delighted to have a fantastic Master of Ceremonies, Ambassador Dr. Neil Parson. Dr. Neil Parson is the Executive Secretary for Integral Development of the Organization of American States, and he is also, we're very proud to say, the chair of our honorary council, and a council that he helped to establish. And he's been a tremendous guide for the global surgery movement, for the G4 Alliance, and for all of our member organizations who've come together to support access to surgical care for neglected patients around the world. This event is being co-hosted with our partners at Safe Surgery 2020 and with generous support and collaboration from GE Foundation. And Ambassador is going to be walking us through today. Just to give you a little background on our brilliant moderator and Master of Ceremonies today, Ambassador Parson is the former ambassador of the Republic of Trinidad and Tobago to the United States of America. He is also presently the chairman of the Global Gas Council and also a director of the Young America's Business Trust and the Arthur Locke Jack Graduate School of Business Alumni Board. He was previously the chair of the Inter-American Council for Integral Development for the latter half of 2014, vice chair of the Permanent Council in 2014, and chair of the Permanent Council from April to June of 2015. And Ambassador Parson, I should mention, is also a physician, and so he's bringing both medical experience as well as tremendous experience in the world of intergovernmental relations. Thank you, Ambassador.
Thank you very much, Mira Mahesh, Honorable Ministers of Health, Excellencies, distinguished guests, friends and colleagues. Let me also recognize Dr. Walter Johnson of the WHO. Welcome again, sir. Members who are participating online, members of the media, bonsoir, muy buenos dias, bonjour, good evening. Good evening. Thank you. I like energy in the room. That's wonderful. Thank you. First of all, welcome, and thank you for joining us this evening for an event marking the importance of surgical care as priority for saving lives, strengthening health systems, and achieving universal health coverage. I'm Ambassador Dr. Neil Parson, and I'm honored to be joining you this evening in my capacity as chair of the G4 Alliance's Honorary Council and as Executive Secretary of Integral Development for the Organization of American States based in Washington, D.C. The Surgery Saves side event is being held in parallel with the 69th World Health Assembly, marking 1 year since the introduction of an unprecedented World Health Assembly resolution recognizing the role of emergency and essential surgical care and anesthesia as part of universal health coverage. Today also marks the International Day to End Obstetric Fistula, a day dedicated to ending fistula, a devastating condition impacting women around the world that can be prevented and treated through access to safe and surgical care. Around the world today, ladies and gentlemen, as many as 5 billion people do not have access to safe, affordable surgical care and anesthesia care. This disparity contributes to over 18 million preventable deaths and countless more cases of disability. A lack of access to safe surgical care not only impacts health and well-being, but has a profound impact on social inclusion, gender equality and equity, and economic productivity. Each year, as many as 81 million people are impoverished as years go by seeking essential surgical care. Surgical care is essential to treat and manage a broad range of conditions and disease categories, encompassing maternal and child health, trauma, non-communicable conditions such as cancer, diabetes, and heart disease, as well as infectious diseases such as HIV/AIDS and others. Without investment in surgical care, millions will continue to suffer needless deaths, disabilities, and related financial catastrophe each year as a result of untreated and preventable surgical conditions. The cost of inaction is too great. Failing to address this burden of surgical diseases could cost low and middle income country governments as much as $12.3 trillion in lost GDP by the year 2030. According to the World Bank's Disease Control Priority Reports, surgical procedures are amongst the most cost-effective of all health interventions in the developing world. We are honored to welcome a distinguished group of special guest speakers who have joined us to share their commitments to prioritize surgical care as part of national surgical planning and capacity building. To share welcoming remarks and to share insights on a video that we will be presenting, I wish to invite Dr. Faizan Abdullah, Vice Chair of the Department of Surgery and Head of the Division of Pediatric Surgery at Lurie's Children's Hospital, Professor of Surgery at Northwestern University Feinberg School of Medicine, and Professor at Johns Hopkins School of Public Health, as well as the Chair of the G4 Alliance Interim Board of Directors. Dr. Abdullah, it's my absolute pleasure to welcome you to the podium, sir.
Thank you, Ambassador Parson. Respected ministers, Minister of Health of Sudan, Minister of Health of Ethiopia, Libya, Representative of the U.S. government, Dr. Ted Trimble, representatives of WHO, Dr. Walt Johnson and Dr. Terry Reynolds, esteemed colleagues, friends and partners from our GE Foundation and more than 70 organizations that comprise the G4 Alliance, it's my distinct privilege to welcome all of you this evening on behalf of the G4 Alliance, a global network of more than 70 organizations that is working together in 160 countries together to ensure that safe surgical obstetric trauma and anesthesia care is available to every human being on this planet. Here at the WHO, this desperate need was identified more than 35 years ago. Dr. Halfdan Mahler, who was the Director General, recognized this injustice that was happening with basic surgical conditions being untreated that cause lifelong disability or death. He recognized that essential and the most basic surgical procedures did not require space-age operating rooms or expensive equipment, but the most precious commodity of humankind, knowledge. He also realized that doctors or the highest personnel that were providing care at these district hospitals that were doing surgery, they were doing surgery at the same time many of them had to do the anesthesia. Many of them also were doing deliveries and doing C-sections, all the while taking care of the injured patients that were coming through those doors, and many times they were providing the medical care as well. Thus, understanding this crisis and this desperate situation, back in 1980, he made a special trip to the largest gathering of surgeons at the International College of Surgeons in Mexico City, and he begged the surgical community to start thinking about radical solutions to address the manpower issues and other system issues, and to really start making plans with governments and the global health community to start building surgical systems. Sadly, that passionate call to action went unheard. That went unheard by professional communities that were in an excellent position to make a difference. And naturally, it went unheard by those outside the healthcare profession. Thus, you can imagine, when we embarked upon the journey of trying to address this crisis of a lack of surgical, obstetric, trauma, and anesthesia care as a global health problem, The landscape and space was barren. In Chile, there's an actual desert, which is considered to be literally the driest place on earth, the Atacama Desert. The locals who have confirmed that this environment is one of the most inhospitable places on earth, where no vegetation and no animal life has been seen for generations. Our situation is not much different. So what happened when Hurricane Katrina, another powerful force of nature, delivered record rain to this barren area? Valley after valley came alive with beautiful flowers. Unbeknownst to everyone, beneath the seemingly barren wasteland, life burst forth under the right conditions. Ladies and gentlemen, let me reassure you, and those of you who know our surgical obstetric trauma and anesthesia community, that we are also ready to give life to overcome the dire situation of our neglected surgical patients and the broken systems. Many of you know surgeons and obstetricians and anesthesiologists. You will understand that while we think we are among the most determined individuals on the planet, which should not surprise you, because it's that kind of boldness that it takes to, for example, take a child with extensive bleeding through an operation and essentially close to death before we can take the tumor out, which would otherwise help save that child's life. We believe that it's individuals like this that make up more than 70 organizations that comprise the G4 Alliance, and we are making a commitment today to support the neglected surgical patient and to improve his or her situation. We are making a commitment to improve the lives of families, of mothers, brothers, sisters. Know that this is a commitment that is coming to life from our global alliance. You should know that while much of the world is concerned about fighting for their own rights, G4 Alliance organizations and all of you in this room, simply by being here, are making a statement that we are concerned about the rights of others and the well-being of others, and this has brought us together here tonight. Know that G4 Alliance member organizations stand ready to assist your government, and we will help you in any way that we can to ensure that surgical obstetric, trauma and anesthesia capacity is part of your national health plans and an essential component of universal health coverage. Thus, as you listen to the rest of our distinguished guests tonight, we have asked them to make a commitment to surgery using the hashtag #ICommitToSurgery hashtag. We ask everyone here tonight to join in that mission with us, and we would ask you to make your commitments outside if you have not already done so. Also to this end, we're pleased tonight to premiere our newest G4 Alliance video, which reaffirms our commitment by launching a specific target for our community of safe surgical care for 80% of the world's population by 2030. Right now, we know that only 2/7 is the best estimate of patients have access to care. Thus, on behalf of the 50 permanent council members of the G4 Alliance who are here tonight and the interim board of directors, again, want to extend my warmest welcome and thanks to each of you. Thank you again for coming tonight, and please enjoy the video.
Rodney was born with clubfoot on the island of Mindanao in the Philippines. Conditions like clubfoot, ones that can be remedied through access to basic surgical procedures, are virtually unseen in high-income countries today. Yet, 95 million children around the world live with a disability resulting from an untreated congenital condition. Less than 10% of these children will ever attend school. Many surgical conditions and injuries can be treated without expensive equipment or supplies. In Rodney's case, treatment to slowly straighten his foot could have begun right after birth using a simple technique to create a brace with supplies as inexpensive as gauze and tape. Had anyone in Mindanao been trained in this technique, Rodney would not have been left permanently disabled. Now, the only option to treat Rodney's clubfoot is a much more serious and costly surgical intervention. 2015 was a historic year for Rodney and the 5 billion people worldwide who do not have access to safe surgical and anesthesia care. The unanimous passage of a resolution by the WHO's World Health Assembly in May of 2015 underscores the idea that universal health coverage must include surgical, obstetric, trauma, and anesthesia care. Combined with this unprecedented show of support by governments around the world to strengthen surgical services, the global health community is calling for a change for Rodney and the billions of other patients in need. To coordinate efforts around improving access to care, a global target has been proposed: safe surgical care for 80% of the world's population by 2030. Our ultimate goal is surgical care for all, but achieving this goal will take time, dedicated resources, and careful planning. Knowing this, the G4 Alliance and its member organizations, in collaboration with key stakeholders, have begun to develop a roadmap to support governments and local partners to build capacity toward creating and implementing national surgical plans. Over the next 15 years, we will track progress toward the goals of access, safety, and affordability of surgical, obstetric, trauma, and anesthesia care through a coordinated global action plan. This roadmap, informed by consensus around 5 framework elements, including messaging, country-level metrics, international standards, operative case log data collection, and tracking of partnerships and synergies, will offer steps to support and resource increased access to safe, affordable surgical care for those in need. Let's work together to transform the lives of the 5 billion neglected surgical patients. Make your voice heard in support of safe surgical care for 80% of the world by 2030 by visiting www.theg4alliance.org.
Thank you very much, Dr. Abdullah, for sharing those inspiring words with us this evening. And thank you very much for the production team of that very meaningful, inspiring video. It reminds us why we do what we do. It is my hope that the momentum being generated through the work of the G4 Alliance and its partners will help to generate global and national prioritization of surgical care for the billions of patients who are in need. We are delighted to be welcoming a number of distinguished speakers this evening who will be highlighting national and regional progress towards strengthening of surgical systems and implementation of the surgical care and anesthesia resolution. Without further ado, it gives me great pleasure to welcome the Honorable Dr. Redi El-Oakley, Minister of Health of Libya and a member of the G4 Alliance's Honorary Council. Dr. El-Oakley has a tireless advocacy for supporting increased access to safe surgical care and anesthesia as an essential strategy for strengthening health systems and providing, one moment please. Let me hit the pause button. I will hit play when he's running a bit late. So I'll stop after this full stop and continue his CV. Meanwhile, Plan B, let me welcome the Honorable Wahid Idris Abu Ghada, Federal Minister of Health of Sudan and a member of the G4 Alliance's Honorary Council. Mr. Abu Ghada has served as Federal Minister of Health and of the Sudan since November 2011. He chaired the Eastern Mediterranean Committee of the WHO from 2012 to 2013 and has served as a member of the Global Fund Board representing Eastern Mediterranean countries from 2012 to 2015. Mr. Abu Ghada is Vice Chair to the President of the Republic for the National Coordination Council for Health, as well as a board member and member of Gavi's Executive Committee. Mr. Abu Ghada, it gives me great pleasure to welcome you to the podium, sir.
Thank you, Ambassador. Excellencies, distinguished guests, ladies and gentlemen, good evening. Assalamu alaikum. It gives me great pleasure to speak today in this special event, and I would like to extend my warm gratitude to G4 Alliance for raising this essential and priority issue. In Sudan, the most common cause of death yet is due to sepsis. We commit ourselves to intervene and change this situation, which need efforts, especially in improving all surgical procedures. In our expansion of PHC to reach the universal health coverage, we are trying to increase the coverage of health facilities and equip them in surgical aspect in order to provide the services at all levels and the most needed. Many challenges facing us in this regard, like the sanctions, financial constraints, training of our staff, and referral system to be in place. The Quality Department at the Ministry of Health in our ministry in Sudan developed a guidelines for safe surgery, training program on safe surgery checklist take place, and piloting now is running in some hospitals. A network between surgeons and anesthesists developed to introduce safe surgery culture and encourage research in this area. We are about to start using the safe surgery package with support from WHO headquarters. Our effort on infection prevention and control include developing and launching National Prevention and Infection Control Manual 2 weeks ago with participation of all related health professionals and research institutes. We also started surveillance system at hospital level. Today is the International Day to End Obstetric Fistula, which was introduced in the resolution 67/147. The General Assembly calls on the international community to use the International Day to significantly raise awareness and intensify action towards ending obstetric fistula, which again same to our aim and goal here. In Sudan, we suffer from obstetric fistula problems. Over 40 years, Dr. Abo Khartoum Teaching Center, this is one of the famous Sudan scientists who work in this field for a long time, and this center has been named by his name. Abo Khartoum Teaching Center has one of the longest running fistula programs on the African continent. However, conflict and the lack of supplies and trained surgeons limited the number of women they were able to treat. Despite of, we receive help from the UNFPA and some NGOs and local also national civil societies. I would like to end my speech today here by saying that Sudan is committed to this program, and we appreciate to be part of G4 Alliance board, we will join hands together for the sake of the patient. Thank you very much.
I thank you sincerely, Honorable Minister. It's my pleasure to welcome to the podium Dr. Mpoki Ulesubisia, who is the Permanent Secretary at the Ministry of Health in Tanzania, and also a member of the World Federation of Societies of Anesthesiologists, and a founding member of the organization, the G4 Alliance. Dr. Ulesubisia is a physician anesthetist and a passionate advocate for access to safe surgical care and anesthesia for all. It's my pleasure, sir, to welcome you to the podium.
Thank you very much, Ambassador, for the privilege that has been expanded to me. I come from a country that has a population of about 50 million with 24 qualified anesthesiologists. We have 257 hospitals and over 700 health centers. As we were coming to the World Health Assembly, the estimated doctor-patient ratio was 1 to about 20,000. That is general. But if we're going to look at the anesthesiologist, that comes to about 1 to 50,000. And if nothing is done, 10 years from today, we would not have enough, as a majority of them are in their mid-age, and about 10 of them have attained retirement ages. The country of Tanzania is beautiful in sorts of ways. It's a place where several studies have been done, and the results of which have had a serious impact on the world of surgery. For those of you that are given to a surgical safety checklist, a pilot was done at Ifakara St. Francis Hospital, whose results now have popularized the habit that has made operating theaters to be very safe. While we are talking of the larger hospitals committing to surgery, a majority of the population in our country are rural-based, meaning that it takes time, money, and sometimes difficulty ways of going to hospitals where surgeries can be effected. Therefore, in order to abate the rising trend of maternal mortality, the government decided to adapt the practice that would provide these services closer to the populations where they are needed most, especially health centers. And so we adapted the comprehensive emergency obstetric and neonatal care. While this in itself was a simple solution to a very complicated problem, we also realized the shortage of manpower to offer safe anesthetic services. While the nation of the United Republic of Tanzania is committed to the provision of safe surgery, this can only be realized upon adequate training of qualified individuals to offer safe anesthetic services. That will take some time, but our commitment is full. Our prayer is, when all is said and done, our words will be matched by deeds, when nurses, anesthetic officers, anesthesiologists will work together in that vast, beautiful republic to offer safe conditions for surgical services, not only for the surgeon, but the patient, as they are given the best of the safe anesthetic services that is available in the world. That is our commitment. Thank you very much.
I thank you very much, PS Dr. Ulesubisia, for your kind words. It's my pleasure to offer the floor to Dr. Ted Trimble, who is Director of the National Cancer Institute of the United States Center for Global Health and a member of the U.S. government's delegation for the 69th WHA. Prior to his time, Dr. Trimble was head of the NCI's Gynecological Center Cancer Therapeutics, where he spearheaded the development of national and international cancer research strategy for the treatment of cervical, ovarian, and endometrial cancers. It's my pleasure to offer you this floor, Doctor.
Thank you very much for that introduction. Honorable ministers, ambassadors, distinguished guests, I'm delighted to be here representing the U.S. government because this is a topic very dear to my heart. I was trained in obstetrics and gynecology and then gynecologic oncology, and so I spent much of my life doing surgery for obstetrical and cancer conditions. We know that surgery is an essential part of primary care, of secondary care, tertiary care, and we know that by strengthening surgery and anesthesia, we can strengthen health systems overall. We also need to remember the importance of working with our colleagues to strengthen clinical laboratory services such as pathology, chemistry, hematology, blood banking, use this opportunity to strengthen emergency services and intensive care services, all of which we need to provide good surgery. We also have to remember the importance of establishing supply chains to permit us to do good surgery. We need to make sure that the time of surgery for an individual patient, we have the right instruments, we have the right sutures, we have staples, we have ostomy bags, we have surgical gloves, IV tubing, IV fluids, antibiotics, anesthetic agents. They all need to be there for each patient every day. So we've heard about the importance of making surgery as a critical part of universal health care. And as we think about universal health care, we also need to think about how we guarantee the quality of that care. So we in the U.S. government are working to address surgery from a lens of cancer, but we see this as something that will potentially have impact across many diseases. We're delighted to be working with the professional societies in the United States, as well as the advocacy groups in the United States with their colleagues around the world on this effort. As an example, we are working now to build consortia of universities in high and high middle income countries, which would then work together with parallel consortia in low and middle income countries to strengthen both research in NCDs as well as to help the partner countries strengthen their health services with a firm focus on surgery and the other disciplines necessary for treatment of cancer and NCDs. So I look forward to the talks and conversations tonight. I think we have made a lot of progress over the last year, and I think I hope that future meetings at the World Health Assembly will be able to continue to mark the progress that we've made. Thank you.
I thank you, Dr. Trimble. It's my pleasure to offer the floor to Dr. Malik Mohammed Safi, who will be representing Dr. Asad Hafiz. Dr. Safi is the Director of Programs at the Ministry of National Health Services, Regulation and Services of Pakistan. Dr. Safi, it's my pleasure to offer you the floor, sir.
Thank you. Honorable Ministers, Ambassador Neil Parson, Dr. Faizan Abdullah, Your Excellencies, ladies and gentlemen, very good evening. It is indeed an honor for me to represent Government of Pakistan on this occasion. I just wanted to share that Government of Pakistan is committed to improving healthcare delivery systems and especially the access to quality healthcare services across the country in coordination with all the key stakeholders, public or private health care providers. In particular, the importance of providing safe surgical services in both urban and rural areas, especially through our secondary healthcare delivery systems. Recently, Government of Pakistan has initiated the health program for providing universal health coverage to 20% of its population living below the poverty line and allocated resources. And in this regard, special focus has been given to quality access to quality surgical care, especially to gynae ops and such sort of surgeries. We have got a population of around 180 million plus, so 20% of population would be covered under this universal health coverage scheme, and this will definitely have a positive impact on the healthcare indicators in our country. In this context, I would also like to share that we have recently developed a national health vision for the health sector, and in this context, surgical care, provision of the quality surgical care through the secondary health care is part and parcel of this very important this national health vision document. And in this context, we are committed to work with the both public and private health sector stakeholders in country to formulate a national surgical plan that is relevant to the needs of Pakistan. Government of Pakistan is developing national vision for health sector, and this surgical care would go into the secondary healthcare services, and this is a very opportune movement that this intervention is taking place. And in this context, we look forward towards G4 Alliance and other international expert groups for active engagement with the government and collaboration in order to support the endeavor which the government of Pakistan is doing and towards the improvement of health indicators of our country. So thank you very much for inviting me.
Thank you very much, Dr. Safi, for sharing the government of Pakistan's perspective. I wish to welcome to the podium Mr. Burak Kibidi, who will be joining us here to represent Dr. Admasu, to give a few words on behalf of the government of Ethiopia. Mr. Kibidi is team leader of the Neglected Tropical Diseases Unit, and his presentation will focus a bit on the work, leadership, and experiences of the government of Ethiopia in rolling out an initiative of the government. It's my pleasure to offer you the floor, sir.
Thank you very much, Ambassador. I'm representing Dr. Kastabran Admasu, the Minister of Health, who couldn't attend this meeting due to unforeseen and urgent meeting at WHA 69. Honorable Ministers, distinguished guests, and colleagues, it gives me great pleasure to address this meeting in highlighting the work that's currently being undertaken in Ethiopia to address the gaps on surgical and anesthesia care. The Ethiopian Ministry has recently revised its health sector transformation plan for the years 2016 to 2020 and has prioritized key public health interventions to promote and improve the health of the Ethiopian populace. During the preparation of the health sector transformation plan, in the past 1 or 2 years, we were able to document different evidences which indicates that essential surgical and anesthesia care are inaccessible to the majority of the Ethiopians. The few hundred surgeons we have mainly work in the major urban areas like Addis Ababa, when in fact the majority of the Ethiopian population resides in the rural areas. Among the curative interventions, surgical care is a great cause of concern for the public, as expressed repeatedly during the town hall public forums of hospitals and health centers. Surgical care defines the quality of hospital care and depends on nearly all aspects of a hospital system. Surgical and anesthesia care are crucial to deal with a number of national priority programs, including maternal and child health, non-communicable conditions, and the very high burden of trauma. In spite of the fact that potential primary health care coverage has reached almost 100% in the country, access to essential surgical and anesthesia care remains a very big challenge. Official figures indicate that few 100,000 surgical procedures are conducted each year, at best, and conventional recommendations estimate that Ethiopia needs at least 5 million procedures every year. Patients are currently on long waiting lists for essential surgical care procedures for many years. The surgical infrastructure, although improving recently, is not adequate. Additionally, issues related to human resources, supplies, consumables for surgical procedures, such as electricity, safe water access, and data management, are some of the key challenges evident in the Ethiopian healthcare system. Cognizant of the fact that surgical care is a major public health intervention towards achieving universal health coverage, and taking in consideration the great impact of surgical care in improving the lives of many of the Ethiopian populace, the Ministry of Health has successfully integrated essential surgical and anesthesia care in major national policy documents, including the Health Sector Transformation Plan and National Quality Strategy for Ethiopia. In response to the World Health Assembly Resolution 6815 on improving access to safe, affordable surgical and anesthesia care, as part of the universal health coverage, the Ministry has swiftly drafted a flagship initiative called SALT, Saving Lives Through Safe Surgery. Following a brief concept note on the SALTs, outlining major challenges, approaches, and strategies in addressing the huge gap in surgical and anesthesia care, the SALTs project document has been informed by rigorous consultations which the Ministry has conducted with relevant high-level stakeholders. The objective of SALTs is to improve access, quality, and equity of essential and emergency surgical and anesthesia care as part of the universal health coverage. SALTs program builds on existing national quality collaboratives, the Ethiopian Hospital Alliance for Quality, EHAC, as a vehicle for rapid scale-up of best practices, and is based on the approach of strengthening the health system building blocks to improve the surgical and anesthesia care. SALT's initiative has identified 8 strategic areas for intervention to achieve the objective of making essential and safe surgical and anesthesia care accessible and affordable to Ethiopians. Following the launching of SALTs, the Ministry was able to incorporate essential surgical care in major national policies, as outlined earlier, established a leadership and governance structure at the national level which follows the work on a day-to-day basis, conducted several awareness creation sessions in major national forums, including the annual review meeting and National Hospital Recognition Day, invested resources in improving infrastructure for surgery nationally. Almost 200 newly constructed hospitals are awaiting to start surgical care as of now. Allocated huge resources, around 50 million USD, to procure essential equipment and consumables for surgical care, developed a national strategic plan for the implementation of SALT's initiative, prepared a national package of essential surgical and anesthesia lists for the country, developed a national list of essential supplies and equipment for identified procedures, mobilized local and global partners to support the initiative, including partners at national level and also international partners like GE globally, and also initiated a surgical leadership capacity building in collaboration with GE Foundation and JOPICO. Lastly, it is my huge wish that this meeting will further highlight the huge burdens of surgery and huge undertakings which countries are currently implementing, and will further develop a push for strengthening surgical care at country level. Thank you very much.
Thank you very much, Mr. Kibedi of Ethiopia, for your country's perspective. And let me also use the opportunity to say thank you very much to all the ministers and country representatives for highlighting here today your country's efforts and your region's efforts, really, in strengthening surgical systems, as well as updating us on the implementation of the work being done towards operationalizing the resolution. I would now like to invite our event sponsors and collaborators to join us to share more information about their firm's work, as well as industry perspectives in terms of GE in particular, who will be joining us here today in sharing their commitment to supporting safe surgical care. Firstly, we have Ms. Terry Pressenham, President and CEO of Sustainable Healthcare Solutions. I hope I got that right, Terry. Thank you. Of GE Healthcare. As President and CEO of Sustainable Healthcare Solutions, Terry's role includes regional leadership of GE's healthcare's operations in India and South Asia, Africa, Southeast Asia, focusing on addressing customer needs across these regions and working with governments, clinicians, private operators, and NGOs to support their complete healthcare system development from startup phase through to established healthcare infrastructure build-out. In this role, she also leads GE's healthcare's investments in affordable technologies, including the major R&D centers in China and India. Terry is passionate about healthcare and global health issues and has devoted more than 25 years in the field. And interestingly, as I invite Terry up, and talking to her earlier, I really appreciated GE's perspective in terms of their efforts to build out capacity globally and their regional efforts in terms of strengthening the infrastructure in emerging and developing countries. Terry, it's a pleasure to invite you to the podium, please.
Well, thank you very much, and I can't help but sit here and listen to the presentations and not feel even more of a sense of urgency for what this means to people around the world. As was said, we are looking at the developing economies, healthcare capacity building. And in January, and based on the work, in fact, that we had done in the last couple of years in India, we decided that it would be important for us to form a dedicated business around just strictly these developing economies. And as I tease kind of internally, it means I'm no longer confused. There's very specific things that need to be done. They require much more relevance around the access and the quality, the skills, the funding, to look at these systems in a different way than what we would do across the developed healthcare systems. A lot of the credit when it comes to this initiative of safe surgery, which GE is a very proud participant and collaborator on, actually goes to our GE Foundation. David Barish, who you'll hear from next, really has started this and planted the seeds. And maybe to borrow the frame that was provided up front by Dr. Abdullah, is that he's put the seeds in still what is a desert. And I think our job as a company is to be able to add the rain and to scale this and make the flowers grow. And I think that's what we are trying to do. We're looking at technologies, not necessarily to take the things that we know and simply try to reduce their costs, but literally to pull out a fresh sheet of paper and think much more innovatively. Because in these resource-constrained environments, we need to think differently. And I think one of the biggest mistakes we would make, in fact, is try to replicate what has been done in the West. While those are great systems, they don't necessarily find their best place in many of these environments. So we're trying to use our great skills in terms of innovation to bring about some very disruptive solutions that will be much more relevant and much more effective in a cost sense. So we're looking at these things, and we're very excited by this. But to do that, as I said, it took some seed money from the GE Foundation to look at the things that keep the capacity of surgical services in these markets. Things like access to oxygen. Where's the oxygen supply going to come when you're sitting out in a village? Where's the skills for others to be able to do anesthesia? How do we train non-traditional people to be able to do safe anesthesia? And then equipment around that. So I think these are some of the things that we're very interested in. But when we look at this, the idea is not to do this for 1 or 2 pilot programs, but to literally take and vet those ideas and then scale them and have a whole desert full of flowers. So with that, I'd like to turn it over to David.
Thank you, Terry. And I know you yielded the floor to David, but David needs to be introduced. It will not be fair to David not to hear who this gentleman is. David, thank you very much. Dr. David Barash is Executive Director of the Global Health Portfolio and CEO of the GE Foundation. And first of all, let me say, GE Foundation, thank you very much. Let me publicly recognize the GE Foundation has formally partnered with the G4 Alliance, and they're the first corporate partner of the G4 Alliance. Thank you for stepping up to the plate and doing so, GE Foundation. Thank you. You are making this world a better place. Dr. David Barash, a medical doctor, is the Executive Director of the Global Health Portfolio and Chief Medical Officer of the GE Foundation. At the Foundation, developing healthcare initiatives are approached with the belief that simple interventions, along with strong partnerships and leaders, are often the answers to some of healthcare's most complex problems. Dr. Barash is a practicing emergency medicine physician with more than 30 years' experience. He has focused a great deal on understanding how new technologies can be commercialized and delivered to close the gap effectively between brainstorm and bedside. It's my pleasure to give you the floor, sir.
Thank you, Ambassador Parsons. I really very much appreciate that. Thank you, everyone, for being here this evening. Ministers, ambassadors, distinguished guests, partners. I would be remiss if I didn't also congratulate Ambassador Parsons on being here during his honeymoon. He got married this past weekend, so we should congratulate him. And thank you, Terry, for your comments about our seeding this initiative. It was, when we first started this and started to think about this, I talked to Asha Varghese, who's here in the audience, who's my partner in crime on Safe Surgery 2020, and said, Asha, I have a new idea for a program. It's called Safe Surgery. And she sort of looked at me and said, well, I don't know, David. I'm not sure that's the right thing. And as it took root, we started thinking about, well, it's a program, but maybe it's bigger than that. Maybe it's an initiative, and maybe we should start thinking about, you know, Safe Surgery is so big, and the Lancet came out with its report. Maybe we should call this a Safe Surgery initiative. But as we've been evolving this and having more and more partners be engaged, G4 and others, JPIGO and others that have been mentioned, and ministers of health, we started thinking, I think Safe Surgery might be more of a platform and something that we can really deliver. But I actually think we need to take it one step further. I think Safe Surgery for all of us is a mission. We need to look at that number of 5 billion people and say enough is enough. We need to step up. We need to collaborate. We need to think about new partnerships. We can all come under the Safe Surgery 2020 initiative, where we can do things separately. But whatever we do, we need to stop and say 5 billion people without access to safe surgery is just too many. We need to get started. So what is Safe Surgery? Safe Surgery is really just that. It's a mission that we're on. It's a mission to enable access to safe, affordable, and sustainable surgery for those 5 billion people who don't have access to that care right now. There's 4 pillars to Safe Surgery. The Safe Surgery mission, I'm going to call it, and I think it says, well, it doesn't say initiative up there, it just says Safe Surgery 2020. The first pillar is leadership training, management training, and I'm going to add to that entrepreneurship training. We believe strongly, it's been a GE mission for over 100 years to teach, to help people learn, to enable leadership. And we believe that the only way to deliver a safe surgical ecosystem globally in a sustainable way is to make sure that leaders at the facility level have the leadership skills, the management skills, and I would say the entrepreneurial skills to be able to make change at their local facilities. And I do want to say, when I first say entrepreneurial to a few people over the last several days, people think about business entrepreneurship. It's not business entrepreneurship. It's being an agent for change and saying, I see that problem, I'm going to change the situation and make a change on that problem. So it's really leadership, management, and entrepreneurship. The second pillar is really innovation. GE is also known for its innovation. Since the days of Thomas Edison, who invented the light bulb, we've been innovating. And we think it's really, really important in order to develop this ecosystem to think about innovation. And we're known for technology innovation, but I think this isn't about just technology innovation. It's, Terry mentioned our oxygen program and biomedical technician training and training nurses and nurse anesthetists to deliver anesthesia. It's about innovating there. It's about innovating new business models, new delivery models, and new training models to make sure that this ecosystem can be sustainable. The third pillar is advocacy. And that is really, I have to thank the G4 Alliance for their advocacy and for bringing us here together to talk about this tonight. It's about getting the message out that safe surgery is not accessible to people as it currently stands, and we need to advocate on an international scale as well as on a national scale to help our minister partners to be able to put it on the national agenda so that they can begin to address safe surgery alongside of us in their own countries. And the last pillar is really about monitoring and evaluation of what we're doing. It's really saying, what's the current state of affairs in a country, in a region, in a county, in a town, and making sure that we measure that, and that as we make change and implement the other three pillars, that we're actually doing something sustainable, something that can make a difference, and something that's actually going to help solve this tremendous problem that's in front of us. The last thing I want to say, which really goes back to this idea of this as a mission, we can't do this without partners. We believe that the Safe Surgery 2020 mission is a big tent. We believe the partners should be our minister partners, they should be our country partners, they should be our civil society partners, our academic partners, and other private sector partners. So anyone who wants to join this mission should be part of it, and we need to make sure that we collaborate and we're effective. I do want to note that our first initiative here has been in Ethiopia, and the Ministry of Ethiopia has been extremely effective at being a side-by-side partner with us, looking at the SALTS initiative, looking at what we're trying to do with safe surgery, and trying to bring them together so that we can march side by side and make sure that as collaborative partners, we can be successful in delivering safe surgery in our first country, in Ethiopia, but we hope many, many countries beyond that and many other regions around the world. So with that, we have a commitment, and this comes from Terry and I. We commit to access to safe, affordable, and sustainable solutions for Safe Surgery 2020. Thank you very much.
Thank you, David, and thank you, Terry, and thank you, G, and thank you, GE Foundation. Colleagues and friends, achieving our goals for safe surgical care will require collaboration and coordination across all sectors, including government, multilateral organization, and members of civil society. I call them the Golden Triangle: government, academia, and civil society. It's literally a three-legged stool. One leg is missing, everything collapses. / civil society, absolutely correct. He said private sector. Let's add 4. It is my great pleasure to welcome here today the Chief of the Sexual and Reproductive Health of the United Nations Population Fund, who is joining us here today to share the UNFPA's commitment to addressing a surgical condition that impacts millions of women around the world. To mark International Day to End Obstetric Fistula, and to share her commitment to surgical care as part of healthcare systems strengthening, as well as women's health and equity. Dr. Laura Lasky is chief of the UNFPA, and she oversees the program and technical work of the organization in relation to sexual and reproductive health. Laura was previously the coordinator of the adolescent and youth cluster and worked on many reviews. She has done extensive work in the area of sexual and reproductive health globally, including in Burundi, Mexico, and Argentina. Her CV is exhaustive, but I'd love to welcome her to the stage, Dr. Lasky.
Thank you, Ambassador, and it is a great pleasure for me to be here in this room because today is the International Day of Obstetric Fistula. And as you know, obstetric fistula is almost exclusively a condition of the poorest, most vulnerable, and most marginalized women and girls. It afflicts those who have lacked access to a timely, high quality, and life-saving maternity care. And so they desperately need and deserve that care, and then they are left for their condition of prolonged labor with obstetric fistula. And this is a human right. The theme of this year's International Day to End Obstetric Fistula is End Fistula Within a Generation. It's a call to transform the world. As we talk about ending polio or ending HIV/AIDS or female genital mutilation, we need to also call for many other forms of suffering, so that we must commit to stepping up our efforts to end obstetric fistula for all and once for all. This means that that means to work also within the call for the 2030 Agenda for Sustainable Development, to leave no one behind, especially those most neglected, invisible, and powerless, including the women and girls living with fistula. Now is the time, and I'm confident that we can do it. For UNFPA, the United Nations Population Fund, ending fistula remains one of our highest priorities, and we will continue to accelerate efforts, both in our own work and within the United Nations system. The global campaign to end fistula, launched in 2003, we have 13 years of a campaign, by UNFPA and partners, has made significant progress towards eliminating fistula and supporting its survivors through prevention, treatment, social reintegration, and advocacy. Surgery has been done. We have trained many surgeons of obstetric fistula, and we have also trained surgeons of complex obstetric fistula, because sometimes it's not an easy surgery. We have also supported more than 70,000 fistula repairs for women and girls in need, and we have also supported campaign partners that have enabled many more women to receive treatment. Yet far more is need to be done. We cannot give up until every woman and girl has the preventive care she needs. That's the first one, but if she doesn't have access to that care, maternity care, and she ends up with an obstetric fistula, she needs to have access to a repair of obstetric fistula. So my commitment today, I stand here during the International Day to End Obstetric Fistula. I have two commitments. One is to repair 15,000 women this year, 2016, of obstetric fistula. Then the second one, and also I think that what we will repair too is their smiles. And the second commitment is to end fistula within a generation. And we hope that by 2030 there will not be fistula, women living with fistula in this world. Thank you very much.
Thank you very much, Laura, for your kind words and your commitments that you have just made. Repairing 15,000 fistulas in one calendar year, in fact 6 months, it's tremendous, and thank you very much for that commitment. Ladies and gentlemen, you have heard several speakers, several country representatives, and dignitaries who identified their own personal commitments as well as their country and organizations' commitment to the cause of committing to surgery and surgical repair of many conditions that we have heard. I would sincerely like to thank all of them. We also wish to acknowledge our co-hosts who are here. I will ask them to stand, please. Erin Barringer and Ashley Eberhardt of Safe Surgery 2020, as well as Sarah Kessler of Lifebox. And please, can you raise your commitments if you have them in your hand? We would love to see them. Thank you very much. Thank you. If you can remain standing with that commitment, just to show it for a reason. We have a step and repeat outside, and we have some blank slates of cards that represents people who have made commitments. We have heard several of them verbalized here. But I'm asking you, we have come to the end of the formal part of the presentation, but I would ask you kindly if you can use the blank cards, put your commitments, go in front of the step and repeat, handle it, hashtag it, advocate, and spread the word. This is what we need. Advocacy, as you heard mentioned, building public awareness towards this end, and we need these commitments verbally and in writing going out so we can adhere to the principles of our words. Our word is our bond, our commitment is our promise, and we want them fulfilled. Having said that, we have actually come to the end of the evening's proceedings. I would really wish to thank all of the speakers, all of our sponsors, all of our collaborators for being part of this initiative. Again, let me publicly thank GE and the GE Foundation for stepping up to the plate as the first corporate sponsor, and all collaborators as well, Lifebox and Safe Surgery 2020. And all of you took time off from your busy schedules to join us here this afternoon. Ladies and gentlemen, I think we know this issue that we are tackling. It's almost a moral crisis. And as I said yesterday, and I'll repeat it here today, all of us are leaders in this world, and as leaders, we have a commitment to make this world a better place than we met it. And if we can do anything to mitigate a moral crisis, and we don't do so, then we have failed. And I'm asking you, please, by the grace of God and the goodwill of our neighbors, to put your hand and lend your efforts towards that end. And I am Neil Parson, and I wish to commit to advocating for safe, quality access to surgical, obstetric, trauma, and anesthetic care. I thank you, and I wish to invite you to join us for the cocktail and network reception. Thank you, and have a wonderful, blessed evening. Thank you.